Okay, so we're going to just run through the very basics of this lecture, Chemotherapeutics of Malignant Diseases. So let's start off with the first slide. So the etiology of cancer, age and sex-related differences. So there are genetic factors, cancer of the breast, colon, and stomach, and heredity plays a role. Then there are ethnic factors, specific receptors, oncogenic viruses, such as the Epstein-Barr virus, which could lead to mononucleosis or associated with nasopharyngeal cancer. Then there are occupational and environmental carcinogens, and these we would call mutagens, and these are substances that change DNA molecules. Then we should think about radiation, and radiation is ionizing, high energy, potent, and penetrates deeply into the body. And then there are immunologic factors. Cancer, different types of cancers, so let's look at the tissues of origin. First, carcinomas. These are found in the epithelial tissues throughout the body. Then there are sarcomas. Sarcomas are malignant tumors which arise from connective tissue. Next, lymphomas. Lymphomas are cancers within the lymphatic tissue. And then leukemias. Leukemias are cancers within bone marrow and blood, such as a hematologic malignancy. Okay, characteristics of tumor cells. We must think about uncontrolled proliferation, de-differentiation and loss of function, invasiveness, and metastatic potential. So we first have a normal cell, then it mutates in the first mutation. This is called initiation. And in the next stage, which is called promotion, we have a second mutation, and then a third mutation. This is the promotion stage. Then there is progression. And in the progression stage, we have the fourth mutation, and then we have cancer cells. So there is initiation, promotion, and progression. So thinking about therapeutic effect of anti-cancer drugs. The therapeutic effect of anti-cancer drugs may require total tumor cell kill, which is killing all neoplastic cells. Achievement of a therapeutic effect often involves drugs that have a narrow therapeutic index, which means that there is a short distance between the drug being therapeutic and it being toxic. Next, a therapeutic effect is usually achieved by killing actively growing cells which are most sensitive to this class of agents. Because normal cells and cancer cells have similar sensitivity to chemotherapeutic agents, adverse effects are mostly seen in normally dividing non-neoplastic cells, such as hair follicles, bone marrow, and sperm. To minimize the effects and resistance, often is used a combination of several agents with different mechanism of action. And the achievement of a therapeutic effect may involve the use of drugs, sometimes sequentially, at different stages of the cell cycle. And these will be harmful to rapidly growing cells. So there have, again, as said before, they are harmful to hair follicles, GI tract cells, and bone marrow cells. Combination therapy. Tumors have the tendency to be resistant to some drugs, called heterogeneity, and resistance occurs during therapy with only one drug, which is the proliferation of mutated cells. Several sites of effect are possible with drugs with different side effects. And there is cumulative biochemical damage, which appears in cancer cells. Okay, and considering the practical use of cancer drugs, the doses are expressed in milligrams per square meter squared of body surface. And there are precise doses and dose effect ratios, which we have to know. So this is just a summary. I'm just reading it, but this is very good for my memory, so I can recall the details from the lecture. Remember, it's in milligrams per meter squared. Next, the toxic effects of anti-cancer chemotherapeutics. So you have myelotoxicity, alopecia, losing hair, loss of appetite and weight, nausea and vomitus, taste change, stomatitis, esophagitis, constipation, diarrhea and fatigue. And then systemically, cardiotoxicity, neurotoxicity, lung damage, sterility and teratogenicity, hepatotoxicity and nephrotoxicity, wound healing is reduced, and also growth in children, and also there's cardiogenicity. So let's talk about the anti-cancer drugs. So we must first think about the mechanism of action and think about the cell cycle. And there are some that work by intercalation, some by blockade of metabolic steps in the DNA synthesis, some that reduce the enzymes in the regulating cell cycle, that work on the enzymes, some that reduce or decrease RNA synthesis, some that break down the protein synthesis, and others that work on microtubular functions. So we can look at the cell and notice that they are working different parts of the cell cycle. For example, in the S phase, in the synthesis phase where DNA is replicated, the DNA synthesis inhibitors work here, and in the G2 phase, in the second growth, where growth and preparation for mitosis is made, there you would see things such as bleomycin and etoposide and teniposide, which are from the topoisomerase 2. And then there are, in the mitotic phase, you would see mitotic inhibitors.